Hello there. Let me just round out this week's lectures by showing you some criticism of the idea of dissociative identity disorder, the Spanos paper that introduced the sociocognitive model of dissociative identity disorder. Let's just go quickly over that. And then let me show you a paper done by my colleague in Leuven University, Ivan Manguilli, who looked at dissociative amnesia cases in peer-reviewed literature and examined whether they were actually qualified to be called dissociative amnesia, whether they met the criteria from the DSM. So this is Spanos' 1994 paper. It's an important paper because it was one of the first introductions of the sociocognitive model of multiple personality disorder, which is now called dissociative identity disorder. Now, this is an alternative explanation of what is going on with dissociative identity disorder. One, the trauma model is that trauma causes multiple personalities, and then you have to relive traumas to undo multiple personalities. But in the sociocognitive model, if I could summarize it, it says that sometimes it is iatrogenic in that the social pressures of going through a therapy where the therapist believes that you have multiple personalities creates a role for you to play, and you fill that role by enacting different personalities as the therapist asks you for them. So there's a social aspect and a cognitive aspect. So let me read from the abstract here. It says that people who enact multiple identities behave as if they possess two or more selves, each with its own characteristic moods, memories, and behavioral repertoire. Under different names, this phenomena occurs in many cultures. In North American culture, it's frequently labeled as multiple personality disorder. This article reviews experimental, cross-cultural, historical, and clinical findings concerning multiplicity and examines the implication of these findings for an understanding of MPD. Multiplicity is viewed from a sociocognitive perspective, and it is concluded that MPD, like other forms of multiplicity, is socially constructed. It is context-bounded, goal-directed social behavior geared to the expectations of significant others, and its characteristics have changed over time to meet changing expectations. So in other words, the expectations of important others, such as therapists, create goals, and the patient pursues those goals with the help of the therapist and comes to believe that they have multiple personalities and play the role of having multiple personalities. So that is Spanos' theory, and this sociocognitive theory has been expanded by Scott Lilienfeld since then, by Stephen Lin. I kind of subscribe to this sociocognitive model to a certain extent as well, and Harold Merkelbach is part of that movement as well. And there is another important paper that's just come out very, very recently. Actually, it hasn't come out yet. It's just been accepted into clinical psychological science, which is a fairly big deal, where they looked at past case studies of dissociative amnesia and found them wanting. So in other words, they found the cases not actually matching criteria that is in the DSM-5. So I'm very happy with this paper done by Ivan Manguilli and Otgar and Merkelbach. These are people who have been talking about this for a few years, and I was very pleased to see Ivan do this. So this is the abstract here. And I couldn't find this on Google Scholar. I think it's going to start appearing in Google Scholar in a few weeks. So hopefully I can find a link to it to put into the Moodle. If I can't, just I may have to email you an advanced copy. Okay, so here's what it says about dissociative amnesia. Dissociative amnesia, defined as an inability to remember important autobiographical experiences, usually of a stressful nature, is a controversial phenomenon. The definition, of course, goes wider than that, but they can't fit that in here. We systematically reviewed 128 case studies of dissociative amnesia, reported in 60 papers that appeared in peer-reviewed journals in English over the last 20 years. Our aim was to examine to what extent these cases actually met core features of dissociative amnesia, All cases were about reports of autobiographical memory loss, but the evidence offered in support of dissociative amnesia interpretation was often weak and plagued by an ambiguous heterogeneity with respect to nature, etiology, in other words, cause, and differential diagnosis of alleged memory loss. Most case studies failed to rule out plausible alternative explanations of dissociative amnesia, such as ordinary forgetting and malingering, and also head trauma as well. They don't mention that here. We encourage clinicians and researchers to more critically investigate alleged cases of dissociative amnesia and to provide criteria on how a dissociative amnesia case ideally would look like. So this is a very important case because they didn't find one case of genuine dissociative amnesia, basically. So in other words, all the possible different causes that could explain it were not ruled out, so they just assumed it was caused by trauma, or they assumed it was dissociative amnesia that was psychogenic in origin, when it could actually have been caused by another cause, that was not trauma. It could be that there was not a blockage of memory, but people thought they had a blockage of memory. It may be that the memory was not inaccessible for a time, but the people thought it was inaccessible for a time, and so on. So it's just interesting that when you really look for evidence of dissociative amnesia or for repressed memories, skeptics like me and these researchers really don't feel that there's any credible evidence for the strict definition of dissociative amnesia or for repressed memories. So that's all, folks. I think I've given you enough minutes, about the right amount of minutes of lecture for this week, so I have to stop here. There's more to talk about, but if I have any more topics to cover, I'll put them in another week. Hope you enjoyed the foray into trauma and dissociation theory. And in this little mini lecture, I gave you some leads as to how to investigate more. If you're interested in the sociocognitive model, you know that is something you can read about. And you can also look into doubts about dissociative amnesia from the Manguilli paper, and there's other papers too, such as Harrison Pope's 2007 paper as well. I'm just trying to give you leads. If you want to go down a rabbit hole, you can go further if you want. But anyway, that's enough lecture for this week. I hope you enjoy the readings, and I look forward to talking to you about your questions on Friday. Okay, thank you very much. Bye for now.